And now it's my pleasure to reintroduce Kelly Gibo and Carrie Altoff, from whom you heard yesterday in the COVID session. And if we could pull up their slides on plans for IHCC COVID-19 research, and Kelly and Carrie, take it away.
Thank you for having us. Really appreciate it. And thank you for the great discussions yesterday. So we really appreciate the opportunity to come back and have a lengthier discussion today about COVID-19 research in the IHCC cohorts and how do we move things forward. After the discussion yesterday, we had a joint meeting where we talked a little bit about what are the goals of today's session. And what we're hoping to do is to build consensus about COVID-19 research questions that can be answered by more than one IHCC cohort. And the goal of conducting COVID-19 research within the cohorts in the IHCC is to produce scientific evidence that will inform clinical outcomes, inform scientific, programmatic, and policy decision-making in communities around the world. And we think the IHCC's scientific contribution to the COVID pandemic should be unique and suited to the strengths of the collaboration. Yesterday, we had 4 speakers that highlighted aspects of the COVID pandemic that the IHCC may be uniquely positioned to investigate. Dr. Cerulli highlighted the genetic variants influencing the human response to SARS-CoV-2, noting the approximately 1% of people carry the missense variants in SARS-CoV-2 binding regions, but there was not yet a clear signal between the variant and the phenotypes of COVID disease. Dr. Scully noted the sex differences in disease severity and mortality in COVID-19 and urged additional investigations to better describe these differences and understand the potential mechanisms. Dr. Koenen noted the mental health consequences that have been well documented for other outbreaks, including Ebola and SARS, and given the extent to which COVID is reaching around the globe, what the mental health impacts are likely to be for COVID. Longitudinal cohorts are uniquely positioned to look at changes in mental health before and after the pandemic, and she thought that we would be really in a good spot to do so. And finally, Dr. Stephenson described the epidemiology of COVID in Iceland, reporting 14% of the population have been screened, with impressive data on viral haplotypes and transmission networks. He noted there was nearly 1,800 Icelanders who had been COVID confirmed, that 10 had died, and there had been a declining proportion of tests that were positive since late March. These talks led to a number of important research questions that we believe the IHCC is well positioned to ask and answer, including how do social distancing interventions impact the exposure to SARS-CoV-2 by geographic location and time? What are the genetic features that drive susceptibility, potentially stratified by sex? And what are the differences in disease severity by sex and comorbid disease? Did COVID-19 change mental health? And if so, were some subgroups more vulnerable than others? And these are just some examples of the questions that arose from the talks. There were other suggestions suggested by you as well within the chats. Many of the ideas that were in the chat were related to questions that could be answered using biospecimens and specified assays, including the use of older serum specimens to validate serologic assays, understanding potential levels of immunity in the cohort, the importance of cytokine profiles and multi-omics on mechanisms of COVID-19 infection. There would need to be solid vetting of the biospecimen and testing protocols, and perhaps even recommendations made, as well as efforts for data harmonization for cohorts that are currently working with biospecimens and testing protocols. There were also suggestions for digging deeper into the COVID-19 experience of isolated populations, differences by ethnicity, and the impact of country-level approaches to social distancing on transmission rates. All of these were excellent suggestions. Based on your comments, we've revised the potential research topics presented yesterday, noted in italics here. There's an increased emphasis on understanding the impact of social distancing interventions on COVID-19 outcomes. The role of ethnicity and potential other demographic risk groups, including age, should be used in describing the global collaboration of cohorts. And with the help of EHR data, a better understanding of the comorbidities impacting COVID-19 outcomes across the globe may provide additional insight not only to public health planning, but also to disease mechanisms. Finally, the role of biomarkers, including cytokines, on disease mechanisms and outcomes could be further investigated, particularly among cohorts interested in obtaining biospecimens or leveraging existing ones. In determining the most appropriate COVID-19 research path for the IHCC, it's going to be important for us to consider the unique aspects of our cohorts. First and foremost, the IHCC has a truly global reach, which is needed in order to fully understand the global pandemic and answer questions about differences by country. The IHCC cohorts have rooted themselves with their participants' communities and have established their cohort infrastructure. Second, the heterogeneity of the COVID-19 experience across the globe, coupled with the global research global reach of IHCC potentially allows for determining the impact of social distancing interventions, access to testing, access to healthcare, and other structural level differences in COVID-19 related research health outcomes. This information is particularly useful in planning for the next pandemic. Third, in addition to biospecimens, EHR, surveys, environmental and genomic data round out the diversity of data types that could all play a key role in data collection for COVID-related research. Diversity also exists across the populations captured in the IHCC, which allows for deepening of the understanding of who is at greatest risk for negative COVID-19 health outcomes. Finally, each cohort is large, and the potential sample size for COVID-19 research from this group is likely to exceed most other studies of COVID-19 in the world. I'm going to turn it over to Carrie to walk us through the data from the survey that the IHCC cohorts regarding COVID-19 collection and interest that was filled out prior to the meeting. I want to thank all the cohorts that spent time doing this, and I'm going to let her talk about the actual results.
Great, thank you. Next slide, please. So we were able to better gain some insight into the feasibility of COVID-19 research through your willingness to complete the short survey about what your cohort is doing or wants to be doing related to COVID-19 research. And we were impressed to see that half of the 60 cohorts that responded to the survey report capturing SARS-CoV-2 test results. Next slide, please. So COVID-19 disease outcomes currently captured by half or more of the IHCC cohorts that responded includes death, hospitalizations, ICU admissions, mechanical ventilation, and or recovery at home. And interestingly, there's nearly a third of responding cohorts that note the capture of asymptomatic carriers, a group from which more information is needed to inform interventions to reduce transmission. A smaller but still substantial group of 12 cohorts reported the ability to access biospecimens from confirmed COVID-19 cases. Next slide, please. When it comes to biospecimen collection and testing for COVID-19 or related antibodies and cytokines, there is notable interest by IHCC cohorts as evidenced by the additional ideas for research questions that came in yesterday, as well as more than half of the responding IHCC cohorts affirm their interest in conducting COVID-19 related assays. So the additional data that could be leveraged or collected for COVID-19 scientific investigations under the 3 proposed research topics include demographic characteristics, host genomics, environmental exposures, and mental health measurements. Finally, to ensure appropriate context, the dates of changes in social distancing guidelines or mandates will also need to be noted as this pandemic has been moving very fast, and countries have demonstrated their ability to respond quickly with social distancing interventions that we have already begun to see once again change with the passing of time. So based on the survey data, the majority of the 60 IHCC cohorts that responded noted they were capturing at least one COVID-19 data type shown here in this bar chart. And from these data and the data in the prior slides, it's clear that there are existing data that could potentially be harmonized, as well as enthusiasm for new data collection and efforts to contribute to a better understanding of the COVID-19 pandemic. So based on the survey results and the types of data that were noted as being collected by each cohort, we think that an impressive number of cohorts may be able to participate in COVID-19 research in one of the more proposed areas, making these areas feasible for IHCC research. Further, we think these areas leverage the strengths and the unique aspects of the IHCC collaboration, making these questions well suited. And please note that the number of actual cohorts participating in studies of specific research questions within these 3 topic areas will likely change a bit from the numbers you see here, as these are estimates to determine the feasibility of studying these 3 research areas in IHCC cohorts. The actual number will be a function of the willingness to participate and the availability of measurement of the necessary constructs for the specific research question. So now I'll turn it back over to Kelly for next steps.
So how do we move forward, focusing on these potential areas of COVID-19 research? We've come really far in the past 2 days thinking about the unique contribution the IHCC can make to this global pandemic. And now it's a time to get involved and push the science forward. We propose, or it has been proposed, that several different scientific working groups, or SWIGs, will be formed around research areas of interest. And these research working groups will work to articulate research questions of interest with appropriate aims and hypotheses. The study design and measurement details will be fleshed out specific to the study questions of interest, including tackling the important questions of what types of biospecimens could be recommended for collection, which types of assays would be best suited to the question to be answered, the question proposed to be answered. Questions regarding how to best leverage the metrics of effectiveness of social distancing interventions that have sprung up on multiple web-based dashboards for monitoring COVID-19 pandemic will be addressed. If helpful, crosstalk between those interested in these measurement issues can be managed across 3 scientific working groups. Finally, a statistical approach can be drafted for the research questions of interest. The deliverable from each SWIG includes a proposal to ask and answer a research question of interest, and we're hoping that everyone will sign up for one or more of these by May 12th. So, Jeff or Terry, could you comment on what the support that could be offered for the SWIGs might be?
Sure. So the Secretariat has been supporting work streams, as you know, since the inception of the IHCC. And so this would be, an administrative function, helping to put the groups together, schedule their meetings, take minutes, and help the leader of that group, whoever it is, chart a path forward. I hope that's sufficient for now, but it is a coordination function more than anything else. That's
terrific. Really, I think that would be very helpful. So there's a poll after this asking you to express your interest in multiple different SWIGs that is going to come up. But rather than do that, we thought it might be useful to take the pulse of the group across these areas and to open up for discussion. I see some comments in the chat, which I'm trying to follow here. But maybe Terry and Jeff, we could sort of moderate that as we go through as to, it's hard to follow the questions.
Sure. Yeah, no, it's, so we'll try and help you out with that. So we did have a question about at what point antibody tests should be done to understand false negativity of a rapid test. Is that from the date of start of symptoms or date of recovery, or when?
Great. So that's a really important question. We've been doing a lot of work looking at these sero studies and the assays that are being employed for sero studies, particularly if we have situations where we're not necessarily going to be knowing something like the date of symptoms. So we're busy working on that, and it is one of these really important points we get right from the start. One way we could go about Claire, you're muted. Mm-hmm. Okay. One way we could go about making sure that we are selecting the right assays for the questions is, in addition to the SWIGs based on the research topics, we could have a biostandards working group that defines the SOPs and standard measurements of data to be captured for COVID and other IHCC projects. So this would also then interface with Atlas. So that suggestion was made by Jeff in our discussions yesterday afternoon following our bigger group discussion here. I think that's a really important key aspect of how we move forward, as there have been a lot of questions about what are the biospecimens that we need to do, what is the timing of those specimen collections for the specific assays. So I think that is definitely something we will be moving forward on to ensure that the measurements being taken here specific to COVID can be used extensively for not only these 3 research areas, but potentially additional projects that may come up.
Great. All right. And I see Mary De Silva has raised her hand, and we have a question from Mike Gassiano. So Mary, could you speak, please?
Right, thank you. So that was fascinating. Just a suggestion that could easily be done across all cohorts, and something that we're doing as part of the core questionnaire we're developing for low and middle income country cohorts, is metadata on the social distancing measures, the timing of any lockdowns, etc., at a country level or at a regional level if the countries are very large. And then if all cohorts can collect that same metadata, then I think lots of interesting research can be done, even if biological samples aren't being collected. And again, to kind of reiterate the importance of having harmonised questions across cohorts, if at all possible, would be wonderful. And again, welcome and be very happy to work with IHCC on that. Thanks.
Great, thank you, Mary. And we might just note that Alison Motzinger has noted that she'll be talking about social distancing measures in her talk that's coming up. Mike had asked whether the antibody results were being returned to participants, which could be valuable to a participant.
Absolutely. So each cohort, I think, is going to have to make their own decisions in terms of what they return to participants. And I know certainly within all of us, we've been talking about how to do that in a responsible way, both in terms of research as well as in terms of socially responsible to participants, understanding that it may or may not convey immunity. And so I think that's going to be an important question for each group to recognize locally within their own specific group as to whether this is something they can do now. And it's also going to depend on what these antibodies end up meaning. So as you know, this is a constantly evolving field, and Carrie and I and others have been talking with many across the globe about the impact of serologies and what can we infer from them. I think that the knowledge is expanding rapidly, but whether we're able to return, I think is going to depend on you and your specific cohort.
Great, thank you. Katerina noted that she may have missed the COVID survey and would like to answer it now. And it sounds as though that's a possibility. We can reissue it again or repost it again. Jeff or Eric, do you want to comment on how we would do that, or is that something we'll figure out a little bit later?
I don't have a comment, but I don't know who is administered. If the poll were administered, is it possible there it is. It's just popped up again.
Excellent.
So I don't know if it was the poll or if it was the actual survey people were referring to. So if the survey people didn't have a chance to respond to regarding their data types, we can also send that out as well. But in terms of the poll, we'd certainly be interested in your information here on what you think the most important areas are and what you might be interested in pursuing in your cohort.
So Melanie has suggested that running some of the discovery queries in the IHCC Atlas browser would be really fun and stimulating to do. It's a great use case, and that seems like an excellent idea. So is anything further needed to be able to do that, or do we have all the data we need to run it?
Yeah, it would be a question of what's been contributed to Kelly and Carrie through. I know we've got the survey. It's great to see so much mobilization very quickly. Data dictionaries would be a great start.
Great. So how would we? Well, maybe that's something that we can pursue collecting. In order to be sure that the cohorts know what to send and when. Great. There's a question from Carolina. Have you thoughts on how to harmonize different assays used in the cohorts to define positive and negative cases? A challenging issue, to be sure.
Yeah, so I think there's a couple of different levels at which we will need to be considering that, because for cohorts who have already begun running antibody assays and with different optical density cutoffs, if you're using ELISA, for example, I think we'll have to collect, again, this importance of metadata, right? So which assays are being used, what the ODs were, because I do think there are some statistical approaches we can do where instead of confidence intervals, we set credibility intervals, where we think about the sensitivity and specificity of these tests and the influence of that on the potential outcomes that we're seeing. Given the size of most of these cohorts, I think what we'll likely see is that if there are major differences that we can adjust for using credibility intervals to look at these potential differences across assays, if we still see differences there, we are more likely to be able to make a solid inference that is actually going on at a population level than the fact that it is just the assay and the test. These assays are still rapidly changing here in the US. I wonder what it's like for you all around the world. And I do think, that metadata will be critical. When were the tests run and which assays with which ODs? So then on the back end, we can run some statistical analyses to see what the variability is in classifying individuals as positive or negative cases. It's an excellent question.
Great. Yes, and there have been other questions such as, can we use dried blood spots for
one of the other questions that I saw come up in the chat was the question about short surveys on psychosocial impacts. And I think a number of groups have begun to run surveys, as well as some were anticipating it. We have tried to assemble what the surveys are to potentially look at data harmonization, because I think many people are using the PHQ-9 or other validated questionnaires, which could potentially be harmonized. So I think that's going to be something important if there is a scientific working group that looks at mental health, that would be one of the things they could potentially do, is the data harmonization of those across the different cohorts.
And it does seem as though there's a need for that biospecimen working group as the questions that are arising from that.
one of the other things I wanted to comment on, and I saw Jeff commented on it as well as Mary, is not just the impact on mental health, it's the ability to cope and resilience. And I think those are going to be also very important. And a number of the surveys I have seen have looked at some of those questions. And it might be worth it for the group to think not only about mental health and what are the impacts in terms of anxiety and PTSD, but also how well do people cope and respond to this. And I think that part of that's going to depend on some of the economic and occupational questions, as Marcel and others have been commenting in here. Really excited for this group to be thinking through what those questions should be and how to harmonize across what's already been launched.
Okay, great. No, that's a good point. And Marcel put it in a note that he doesn't have a microphone. We're sorry, Marcel, but thank you for participating in the chat. One thing we might note is that we do recognize that extracting some of these data will require some resources. As we define and launch projects, we are anticipating the need to provide some support for that. It's not going to be a huge amount, but hopefully it won't take a huge amount. So we will work with the cohorts to be able to extract these data if resources are needed. Jim Lacey wanted to follow up on Marcel's idea. Jim, do you have a microphone, and do you want to expand on your comment?
Thank you. Good morning, everyone. One of the things you've been hearing in California and other places is the balance between, projected future increase in mortality and health effects due to the economic short-term disruption of COVID. And at least in the U.S. and elsewhere, cohorts could look back at the last 10 years and quantify some of the differences that we see across region, across cohorts, across demographic groups about what the economic downturn 10 years ago did to mortality. It would put us in a good position then to have some reference data and comparison data for what is likely, unfortunately, going to happen in the next 12, 18 months beyond that.
Excellent point. We probably should wrap up. I'm going to let Kelly and Carrie take whatever summary comments they'd like to make.
We really appreciate this great feedback. For those of you who have had the ability to comment in the chat, we will certainly put all of that together. We will work with Terry and Jeff on figuring out the working groups, and certainly please feel free to email either one of us with any questions or suggestions. All of the comments that were in here were terrific, and we look forward to working with many of you and the Science Committee on thinking through what are the next best steps for the IHCC and doing COVID work. I think that this group is really uniquely positioned to be able to answer some very important questions. And I appreciate the opportunity, I know Carrie does as well, to come and meet with you and to have these great interactions and thinking through how we can best help in this pandemic. So thank you very much, Terry and Jeff.
Great,
yes, thank you. It was really fun.
Super. Thank you both for all your efforts in this area, and we look forward to a lot of very stimulating research here and a real demonstration of the value of the IHCC collaboration, particularly in this incredible public health crisis.